And our final presenter for today, we are going to learn about the National ALS Registry from Jaime Raymond. She has been at the Centers for Disease Control and Prevention since 2001. In the last 4 years, she has been working directly with the Agency for Toxic Substances and Disease Registry's National ALS Registry. She collaborates with the Center for Medicaid and Medicare Services, the Veterans Affairs, and the ALS web portal data to create a national estimate of prevalence for ALS annually. She also studies the National ALS web portal survey data, analyzing the surveys to learn more about the risk factors that may lead to ALS diagnosis. She recently published a study looking at vigorous physical activity before an ALS diagnosis. And before coming to the National ALS Registry, Jaime worked 15 years in the lead poisoning prevention branch at the CDC. She earned her master's in public health at Emory University with a concentration in epidemiology in 2004 and a Bachelor of Science degree in mathematics from Indiana University in 2000. So Jaime, thanks for being here today. I will stop and you can go ahead and present your slides.
Okay. I am Jaime Raymond. I'm an epidemiologist with the National ALS Registry, and today I'm going to discuss the impact of the National ALS Registry and what we can learn and do to join the fight against ALS. Just a quick disclosure. So just to go over a little bit about the presentation this evening. First, I'm going to talk about joining the fight against ALS. What is the importance of the National ALS Registry and why should someone join it? What is the National ALS Biorepository and how can I join it? Ways to participate in clinical trials and epidemiological studies through the National ALS Registry, as well as why take these risk factor surveys. Then we're going to touch a little bit on what the registry is doing to find causes and risk factors for ALS. We're going to look at the reporting criteria and reporting on who gets ALS and the number of cases we currently have in the United States. We're going to look at how the ALS Registry funds research and how they publish research. So to start off, why is the National ALS Registry important? Well, I think the number one reason is there are so many more unknowns than there are knowns about ALS. So the goals for our registry are to seek out the causes of ALS. We want to seek out risk factors for ALS, whether it be environmental, demographic, occupational, genetics, etc. And then, of course, we want to report on the number of ALS cases in the United States. Previously, we have published on prevalence cases, and by the end of this year, we will have an incident report as well. The National ALS Registry is congressionally mandated. The patients, caregivers, and some of the nonprofit groups push Congress for an ALS registry. Our registry is 100% voluntary, and it's your registry. The ALS research counts on you. So why is the biorepository important? Our National ALS Biorepository helps researchers in several areas of ALS. First, we have genetics. Our samples help identification of certain genes such as SOD1 and C9. We have biomarker identification, indicator of the biological state, meaning how fast or slow the disease is progressing. We're able to see if certain drugs are working or not working for the progression of ALS. And we're hoping to possibly identify a simple blood test that could catch ALS early. The National ALS Biorepository is also able to look at environmental factors while analyzing patients' blood and saliva. We're able to look at heavy metals such as lead and arsenic, as well as persistent organic pollutants that it can be tough to downgrade or break down. Some more details of our National ALS Biorepository. Our biorepository is a little bit different from other biorepositories. We're able to link extensive risk factor survey data with our biosamples if the patients have completed those surveys. Our biorepository is nationally representative. It goes beyond just a referral center. It's user-friendly to the patients. We use in-home phlebotomists to collect the samples. Collecting the specimens, we collect the specimens specifically for our biorepository. These are not leftover samples from another study. We have pre and post-mortem samples in one central biorepository. We also have no charge to the patients. It's user-friendly. We come to your home. The goal in FY19 was to collect 325 blood samples, 125 saliva samples, and 10 postmortems. I think all but the postmortems we were able to obtain. FY20, we had the same goal, but unfortunately, COVID stopped the production or stopped the process of in-home collection. We're hoping to start that up soon for FY21. Our National ALS Biorepository is the largest collection of pristine ALS samples for research you can use for genetics, biomarkers, and disease progression. So here's just an overview to show you exactly what our National ALS Biorepository looks like. So we have the in-home collection, which can be blood, urine, or saliva. We also have the post-mortem collection. Both are housed in our biorepository. If patients have taken the risk factor survey data from the National ALS Registry, we can link those biosamples to the survey data to enrich the sample even more. From there, researchers can apply for biosamples as well as the risk factor survey data for their own research. The National ALS Registry also helps patients participate in clinical trials and epidemiological studies. We know that patient recruitment for research can be difficult and challenging. We also know from our survey data that approximately 95% of our registered patients want to participate in research. The National ALS Registry links patients with scientists who are recruiting for research, both clinical trials and epidemiological studies. The researchers are both domestic and international. They have both used our tool for recruitment purposes. And to date, we have had over 35 institutions use our notification mechanism in order to recruit patients for clinical trials and epidemiological studies. Here's a highlight of some of the notifications that have used the registry, registry notifications. You can see here that we have both pharmaceutical companies as well as universities, and the range of clinical trials is astounding at how much they can, is astounding at what they have recruited for. So now we move on to the National ALS risk factor surveys. We have currently 18 risk factor surveys. These help researchers find clues about ALS. Some occupations seem to be at certain higher risk for ALS. We want to know why. Military service. Why are the veterans seem to be at greater risk of ALS than non-veterans? We look at physical activity, smoking, and drinking. Are these risk factors? I've just recently published on using the risk factor survey data for physical activity and ALS diagnosis. Residential history and pesticide use. Where did you live previously throughout your life, and were pesticides or insecticides used near your home? Traumatic brain injury. Did you have a concussion or a TBI that may have caused your ALS? Disease progression. We want to know how fast and slow ALS is progressing for you and what is affected. This helps us manage the ALS progression. And we also have an open-ended study, an open-ended survey. This allows you to tell us what you think caused your disease. You can take these surveys in any order, and caregiver help is always appreciated. This helps us solve the mystery behind ALS. So as I said, we have 18 surveys. We just had the last one come on board last month, so I don't have any survey data for you. But here are the 17 risk factor surveys that were taken after registration. You can see, starting with demographic, going all the way down to disease progression. These were the first 7 surveys that were released in October of 2010 when the registry launched. And as you can see, these have the most registry responses, with the demographic survey being over 10,000 completed surveys now. From November 2013 until December of 2014, the other 10 surveys have been released. And you can see here, we still have several thousand completed surveys with over 97,000 surveys completed to date. Survey 18, which is a sports survey, just came on last month, and we're very excited to see what this data looks like. Exactly how many cases are there in the United States? Well, some background information we can tell you is that ALS is not a reportable disease in the United States. So what does this mean? Well, it means that ALS is not reported to state health officials except for in Massachusetts, where it is required. ALS cases from private insurances are currently not captured in our registry either. Our registry is a surveillance system, and no system can capture all the cases. We believe that registry captures about 80% of the cases in the United States, but we are always looking to better improve our case ascertainment because we feel like one case of ALS is one too many. So how many cases do we have in the United States? Our most recent publication showed over 16,000 persons were identified as a definite ALS case in our registry. This included the national databases from CMS and the VA, as well as our portal data. This makes an estimate of 5.2 cases per 100,000, which is a slight increase from before. This continues to be more common in whites, males, and persons aged 60 to 69. We also see that males had a higher prevalence than females in all the data sources. These numbers are consistent with other studies, and we do have a more recent study being submitted right now for publication. Registry research that we fund. Why is that important? Because again, there are so many more unknowns than knowns about ALS. The National ALS Registry funds extramural research to learn more about the ALS causes as well as the risk factors. To date, we have 16 research studies that have been funded, with 3 new grants being added. This information will help ATSDR and the National ALS Registry prioritize topics in the future for risk factor surveys as well as epidemiological studies. So some of the areas of funded research that we currently have. One of them is looking at identification of environmental risk factors such as cyanobacteria. Another environmental risk factor study is looking at pesticide use and air pollution. We have funded research identifying biomarkers and genes. One study is looking at the role of autoimmune disease and other disorders, the treatments that are used, and how those can, and some have shown to be risk factors as well as prognostic factors for ALS. Genetics, why certain populations seem to have lower rates of ALS than others, as well as biomarkers and oxidative stress. So the registry does more than count cases. The National ALS Registry partners with nonprofits, collects survey data, uses the patient portal to have a research notification mechanism for researchers to recruit patients for epidemiological studies as well as clinical trials. We fund research, and we have a national ALS Biorepository. So the National ALS Registry and MDA are vital partners with the goal of curing ALS.
Thank you, Jaime. Can you show us how can people join again? Can sign up for the registry?
Oh.
Sorry.
Yep. That's okay. Let's see if I can go back to sharing. If you go to our webpage, the cdc.gov/ALS,
okay,
There is a Join the National ALS Registry.
Okay, perfect. And once you join, you've done it, right? You don't have to do this on an annual basis, correct?
Correct. Once you join, and we have risk factor surveys. You'll get emails about notifications. If you click that you're interested in notifications of clinical trials, you'll get emails if you're interested in joining the biorepository and things like that.
So, and just to confirm, this is only for people with a diagnosis of ALS, not PLS, correct?
Correct. This is just ALS. So during registration, we do ask a series of 5 questions to make sure they are an ALS patient.
Okay, perfect. I just wanted to clear that up. All right. Thank you, Jaime, for your time this evening. I appreciate it.
You're welcome.